This is a story you've probably heard about. It's made national news today. An anchor in Tulsa, Oklahoma experienced a medical emergency, and it happened live on the air.
I know, really frightening incident, and it's prompting conversations across the country about how to recognize the signs of a stroke. Our Rosalyn Freeman joins us live in the studio with more. Rosalyn?
Social media is buzzing about the scary moments leading up to the anchor's stroke. I talked to Dr. Emily Landrum about how people can learn to spot stroke symptoms fast. Julie Chan, a news anchor at the NBC affiliate in Tulsa, Oklahoma, said she knew something was wrong. She just didn't know what that something was. It turned out to be a stroke.
There are a few different types of stroke, but they ultimately all cause a lack of blood flow to the brain. And so when that brain tissue is not getting blood flow to it, you lose the proper function of whatever area of the brain is being affected. So if it happens in the area that helps you speak, that's where you get the speech problems present first.
But how do you know if you or someone around you may be having a stroke? There is technology that can communicate what's happening in your body.
The Apple Watch can help detect atrial fibrillation, which is an irregular heartbeat, that if that goes untreated is a high risk factor for having a stroke. So it can detect, abnormal heart rhythms, and that can be a cause for stroke.
Dr. Landrum offers a piece of advice for people to seek medical attention fast.
So if you really suspect a stroke, you want to call 911 so that they can get help to you as soon as possible. The most important thing in recognizing a stroke symptom is that we get you treatment as soon as possible.
Dr. Landrum says if you need help remembering the symptoms, use this simple acronym, FAST. F stands for facial drooping. A for arm weakness. S, speech difficulty. And T, time to call for help. Learning to think fast could save a life. Another thing to remember, if you think you may be having a stroke, call the ambulance. Don't try to drive yourself to the hospital. Some types of strokes can be treated effectively, but first hours are crucial.